But I do want to get us started and be mindful of time. My name is Susan Arnold Christian. I work full-time for SHPE National. Like I said, I work out of Kansas City, Missouri. And I'm so excited for this. This is our second event in this series that Honeywell is supporting with SHPE, and we're so grateful for Honeywell's support in this effort. I think it speaks a lot about a company when they invest in our whole selves, right? And so navigating mental health care and kind of looking at these issues related to our Latina communities and how we interact with mental health and what does that look like for us, I think is so critically important. And so I'm just so grateful for their support in this effort. And I'm also very grateful for our two speakers who are here and who have been working on this content to share with you all today. And I will let them do their self-introductions, but I will just say that you have some great experience and expertise here that we're really excited to share. So I will encourage you. I think we've all done 100+ virtual events, right? They are always more fun when you engage and interact in the chat as much as you can. And so send those introductions, send those questions. If you have comments or resources or ideas, it doesn't just have to be a question. Feel free to engage and interact with each other in the chat. We'd love to see that. And then also just be aware that we are recording this and we will be sharing this on YouTube. We will not be sharing the chat, but we will be sharing the content. And so as much as you feel comfortable sharing your camera, I think it'll just be the speakers whose cameras will be on the recording, but just wanted to make you aware that we are recording it for people who couldn't be here. So with that, I'm going to pass the baton over to our two speakers and let them take us away.
Thanks, Susan. Hi, everyone. I hope you're doing well wherever you're joining us. I think y'all are joining from all over the country, and I see Puerto Rico too. So it's great to see y'all. In the next slide, we'll kind of go through what we'll talk about today. You're joining us again on how to navigate mental health care, right? So we'll talk about what does mental health actually mean. If you came to the first one, it'll be somewhat of a review here around, what is mental health and what are the messages that we receive about mental health growing up. We'll talk about self-care and practices for mental health, but we'll also talk about identifying culturally aligned mental health care systems, right? So how do we ensure that we're getting the care that we need as we consider our identities. So some things to keep in mind in the next slide here. So as Susan mentioned, we'll be recording the general information, but we will have time to talk through some of the questions. We may do a breakout or we may stay here in the room depending on how many people are joining. But as we come to that, again, we'll stop or pause the recording so that it becomes or it is still anonymous there. We'll also just keep in mind to kind of step up and step down, right, as we're asking questions or having a discussion to just monitor your own airtime, as they say. And then keep your microphone muted. Feel free to be on or off video as you like, just so that there's no echoes and whatnot. But also feel free to comment in the chat or come off mute if you do have a question. And then of course, everyone's experience is valid, right, and can vary. So please be respectful if we are sharing our own experiences. So you're probably wondering who we are. So this is myself and my mental health journey. So I am, as you see the flag behind me, my family is Mexican and I'm Mexican American. I'm first generation student, but also first generation American. And so you see me here in my Latino graduation from undergrad from UT Austin, and something around my mental health. That's when I started learning more about my culture, but as well as ensuring that I take care of myself. Right? We'll talk about how some of the messages that we grew up, but mental health was really never talked about, or it was kind of dismissed. Right? So it wasn't until then that I learned about that. And so some ways that I take care of myself and kind of self-care as well is by being outside with friends, right? I love hiking. You see me with some friends here hiking in Ohio. I also like running or pretending like I run sometimes. So this was my first 5K. And then, although it's kind of tiny here on maybe on the screen, that's my dog. So I like hanging out and just ensuring that I am, taking time away from the screen and from my job. But like I mentioned, it wasn't until undergrad that I learned about mental health. And so it's definitely been a journey in the sense that I also am learning about my own mental health, right? Handling depression and figuring out what that looks like from day to day, or dealing with other things that are going on. So that's me, and I'll turn it over to Sarah.
Hello, everyone. So happy to see all these cities and states from all over. I'm so excited to be able to connect. I think this is the beauty of the virtual world, that we can be on different coasts in different time zones and still able to connect. So I'm excited to be here to share a little bit more with you all about my personal journey, but also my professional journey as well. So just a little bit before we get started, my name is Sarah. I am so happy to be here. Just like Gustavo mentioned, I'm also a first generation college graduate and the first to be born in this country. My parents both immigrated from Cuba, and I am a licensed clinical social worker. So mental health is a part of my professional life, but also my personal life. And I think it's important for me to always share my story because representation, especially within our community, is crucial. So I included the first picture, if you guys see, really was the pivotal moment in my mental health journey, which is the first time that I experienced a panic attack and was diagnosed with generalized anxiety disorder. And that was the summer transitioning out of high school. So you'll see my high school graduation there and going into college as a first time college student, the first in my family, was probably the two big pivotal moments from going to navigating college for the first time and also losing my great aunt, who was like my grandmother, my third grandmother, to be those two pivotal moments in my life that really transitioned or triggered my anxiety. And because of that, I decided that it was important for me to become a social worker and be able to help others. So I graduated, got my license, and wanted to give back to my community and educate others and provide resources. So that's really what has led me here. And you'll see in the pictures all the way from my graduation to what I'm doing now is my love for educating others on mental health and giving back. So thank you guys so much for giving me the opportunity to be here. And I'm so excited to dive into these very necessary conversations. So with that, I'll give it back to Gustavo to start our conversation.
Thanks, Sada. So we thought that we would start out with some discussion, right? So in the chat, what does mental health mean to you? Or I'll take one or two people here. What does mental health mean to you? What are some things that you hear about or think about when someone says mental health? Feel free to one person or so, if you can unmute yourself and let us know what does mental health mean to you, or what comes to mind when we say mental health.
People may still be thinking, but I just want to remind you, if you're in a place where you can't unmute, it's okay. Throw your answer in the chat and we can engage that way.
Absolutely. In the chat, I see focusing on self and mind space, undergoing stress, anxiety, and other body imbalances, and a neat way to cope with this to a healthier self. So you also think about EAP at work. Absolutely. And that's great that you do think about your benefits and resources that are offered through the job. So that's great. I know a lot of people don't know or understand what EAP or the Employee Assistance Program that a lot of jobs have, but they often sometimes come with some sort of mental health benefit or being able to talk to a clinician. For me, it's like the battery you have that helps you deal with things that tax your mind, like work relationships and other things. Absolutely. So these are all great examples of what mental health is, right? It's not just one or the other, but it actually includes a lot of this. So in the next slide here, we have what is mental health, right? So it's intrinsically linked to physical health, right? Oftentimes when we talk about health or we think about our physical health, but we forget or we talk about mental health as if it was something separate. In reality, right, obviously our mind is connected to our body, and so it's definitely both connected. Oftentimes, when you experience something physically, you're actually something's going off in your mind as well, right? So that's why it's important to keep your annual visits if you have access to healthcare, right? And talk to someone about those things. It's on a continuum, so and it's not necessarily only linear, or you're not in a sense at one space in all aspects of your life, right? So on a continuum, some people may be thriving or living life to the fullest, and all the way to the other side of being in a mental health crisis or in distress, right? And you can be in different aspects of that continuum in different aspects of your life, right? So professionally, I may be thriving, I may be getting promotion and really enjoying what I do in my job. But then personally, maybe I'm suffering from a loss in my family. And so, oftentimes we experience things at the same time. It's complex, right? So my mental health looks very different from Susan and Sarah's. And that, again, we can experience different emotions at different times and at different ways. So it's a very complex reality there. It's part of being human and something we need to look after, right? It's both positive and negative. When we think about mental health, we often think about how taking care of ourselves and making sure that, or we think about depression and anxiety and things like that. But of course, it's both of those things, right? It's not just the mental health conditions. It's changeable and worth making time for, and obviously it is also real, right? So again, it's definitely connected to our physical health. But however, what is not mental health? So, Sarah, next slide. You'll see here that it says what is not mental health, right? It's not a sign of weakness if we start talking about mental health and not just in your mind. Again, sometimes when you start getting stressed so much, you'll notice that you start clenching your jaw. Sometimes you'll have your shoulders up and stuff like that. So those are all manifestations of our mental health too, with throughout our body. And so as you start experiencing those things, right? Keep in mind that it's not just in your mind or something that is fake. It's not only illness, right? Like I mentioned, it's also just our day-to-day emotions or something that you snap out of it. And so something to think about only when it feels broken, right? It's something that we should be thinking about it continuously and making sure that we're taking ourselves. In the next slide, I have here some statistics around mental health, right, that I wanted to point out. So about 12.5% in the general population here in the US, you have feelings of worry, nervousness, or anxiety, right? So you're not alone if you're feeling nervous, worried, or anxious. That probably goes up, especially in an election year and in other critical times. I know the holidays bring about a lot of concern, right? Here you see 5% of the population feels regular feelings of depression, right? So not necessarily just only being clinically depressed, but you also feel blue in the last 2 weeks, right? You probably, that's usually the marker of how we understand these conditions. And so you may have felt depressed or out of it, right? So you're definitely not alone. The third leading cause of death is suicide amongst Latino Americans who are 10 to 24 years old. So I did want to point those out that sometimes because of our culture, and we'll talk about mental health within our culture, but because of that, right, there's this untold or unsaid things around suicide and getting to those mental health crises. And so you see here that 10 million Hispanic or Latinx Americans live with the mental illness across the states. The general statistics is 1 in 5, right? So 1 in 5 Americans here live with the mental illness, but it's 10 million or so with and Latinos and Hispanics. The 11th leading cause of death generally, again, is suicide. So I think you can see that drastic difference between the general population and then within the Latino community as well. And then lastly, again, 22% or so Latino, Latinx, Hispanic Americans have a mental illness. So again, you kind of see the differences between the general population and how obviously there's a problem in general stigma, but because of cultural stigma and other things that are going on, it definitely exacerbates that issue. And so now Sarah will talk about some of those cultural aspects.
Thank you, Gustavo. I think in putting this together, we all acknowledge that we would be doing a disservice to you all if we didn't talk about the stigma, the mental health stigma that is still present within our Latina or Hispanic community. So let's start with this question. What did you all hear about mental health growing up? Or what were those messages regarding mental health that you heard? And just like last time, you guys can feel free to use the chat or you can unmute, use the raise hand option, whatever you feel comfortable with. So Fernando said it was never really talked about, so I thought that it was something I should keep to myself. Yes, that is a very common message that we've received within our community. Carolina?
Hi, I would say that as you just mentioned, I think it wasn't brought up as much, and when it was more like, oh, someone has an issue, like a mental health issue, and they need to see a psychologist or a psychiatrist because they're just wrong, like they're struggling, their mind is not rational, and so it's more for like someone who's not being reasonable.
Okay. So it kind of seems like it was put back onto the person, right? Like the person is the one that has the issues, not necessarily a mental health concern.
Correct.
And some other ones come in the chat. It was a stigma of only using when one really needed to cope with a hard situation, or wasn't much something we talked about. Yeah. So usually it was in a moment of crises, right? Or usually a moment when there was something really present, but not so much mental health talked about as something that we need to take care of, like our physical health. That medication is something to be ashamed of, or that it's not needed or helpful, that is less valid than physical health because you're alive and that's what matters. Yeah, so like a sign of weakness or versus a moment of strength of caring for oneself. Yeah, you guys are all on the right track. Unfortunately, most of the messages that we did receive growing up within our community were very negative when it comes to talking about mental health. And that's why it's important for us to kind of talk a little bit about that stigma and why it's important to kind of break through, because a lot of those messages were invalidating and a lot of them are not true. So let's talk a little bit more about that. So you guys talked about it a little bit, but usually a lot of the phrases or the messages that surround around the stigma, and these are just a few, right? You mentioned some other ones, but a lot of it stems from "que van a decir la gente," which is what will other people think or other people say. Terapia es para los locos, right? Or therapy is only for crazy people. Son los nervios, which is, it's just the nerves, right? Not necessarily attributing it to a mental health condition. And also, Dios es el único que te puede ayudar, which means God is the only one that can help you. And we'll talk in the next slide a little bit about where these stem from and what some cultural values have to do with it. But you guys all, hit the nail on the head. A lot of these messages that we received about mental health were very negative and very invalidating. So that's why it's important for us to have these conversations now. So let's talk about what are some of these barriers, especially within our culture. And again, there's a large list of these, so these are not the only ones, but specifically connecting them back to those messages that we received. Our culture and the values that shape our culture are very prominent when it comes to linking it to our mental health. So it's important for you guys to think about it this way. So one of the values and components of our culture, and just to note, our culture is very beautiful. It's very diverse, being a part of the Latin community. Not one culture or one country shares the same values, but it's important for us to have kind of open conversations about what it can look like. And pride is one of the biggest values that we see within our culture that might become a barrier. And I linked this one to the "que van a decir la gente," or what will the people say or people think, because our culture is very closed off in not airing the dirty laundry, right? Like that phrase says, or not not sharing what's going on within the household with others. And that's something that can limit people from getting the services or the support that they need. Familismo is also a concept that is very much integrated within our culture. And that is the concept that, we put our family above even ourselves, and that we involve our family in very important decisions. And again, this is something that can be a very beautiful part of our culture, but it can also be very detrimental when it comes to our mental health, because it can create a barrier and can send the message that you don't need any other support aside from your family. Another huge cultural value or component for the Latin culture is the strong ties to religion and faith. So I mentioned in the other slide about the phrase of Dios es el único que te puede ayudar. God is the only one that can help you. Because the Latin culture is very, very tied to religion and to faith, this is something that's very common that we might hear within our families, but it's, again, very important for us to talk about how it can also create a barrier. It is a huge support, right? And we can talk more about that. But it can create a barrier and can limit people or individuals from seeking additional support. So that is also why we include it here. And now affordability and accessibility, I see it as twofold. It is a barrier, but it's also the truth, unfortunately. There is lack of accessibility and affordability when it comes to services within our community, and we can talk about that a little bit more. But there is the stigma that, we can't afford therapy, or that therapy is not accessible for everyone. And that part does have validity to it. But there are also a lot of community resources that we don't know a lot about. And that's what we want to share with you guys today. It doesn't necessarily have to only be a barrier. So that's why it's important for us to talk about it. Overall, how can we reduce the stigma? So the stigma is something that has been around for a very long time, right? It's not something that we can 100% overcome, but how can we manage it and how can we reduce it? So our suggestions, some of them include modeling behaviors and discussions, right? And if it's appropriate, if you have processed and been able to take care of yourself first, share your story with others. I said in the beginning that representation is very important. So it's important for me to share my story so that I can make connections with others and let them know that they're not alone. So if you also feel the same and are able to take care of yourself, share your story and start educating our community and advocating for our community so that we can reduce the stigma. And then we'll talk a little bit about finding a culturally responsive therapist at the end, because that is also another way that we can start to bring down the stigma and learn more about where our mental health comes from and how it's related to our culture. We'll talk about that in a little bit. So I'll put it back now to Gustavo for diving into the taking care of ourselves portion.
Yeah, so at the beginning, I shared more about how I take care of myself, right? Going outdoors, spending time with friends and family, and my dog. So I know that oftentimes when we think about self-care, it has really been commercialized, right? That we think about cucumbers and going to the spa, and certainly those things are ways to take care of yourself. But in the next slide, you'll see here some self-care and maintenance strategies, right? So as we talked about, that it's something that it's mental health is just ongoing, right? If you equate it or think about your physical health, right, you need to make sure that you are getting your annual physical, that you're taking, if you take medication, that you continue taking them as you're able, that you're having a, healthy diets and things, whatnot. We know that we should be doing those things, even if we don't do them, right? But we should be doing those things to take care of our physical health. Similarly, we need to make sure that we're doing that for our mental health. So, like I mentioned here, setting and following healthy routines, right? Going to sleep and getting that recommended 7 to 9 hours. I know for sure everyone here has probably experienced that if you don't have sleep or you wake up in the middle of the night and then scroll on your phone, you do not have a quality day the next day. But you'll actually feel better when you do have that quality sleep. And I say moving, right, not rather than exercise. We all have different ability in our bodies. And sometimes all it takes is just walking around the neighborhood or going up and down the stairs. If that's what you can do or get yourself motivated, that's fine. Or going to the gym or running and whatnot, right? those are great ways to kind of keep and follow those routines. Finding your support system, right? It's been said over and over around suicide prevention that having a supportive social system, right? Having friends, talking to coworkers and whatnot is a really protective factor or prevents you from, being at risk for suicide, right? So it's really important to have that support system at work, right? Being able to talk and reflect with your coworkers about what's going on in the workplace. At home, obviously talking about a little bit of everything, but definitely personal life and being able to debrief, to talk, to just distract yourself. Those are great things. Unplugging, right? Unfortunately, we go from our medium-sized screen, which is the computer, to our smaller screen, which is the phone, all the way to the bigger screen, which is the TV, right? And it's great to unplug by watching Netflix or TV. I definitely do it. But sometimes we also need to unplug by simply going offline, right? So taking about 30 minutes to an hour or even more from technology, that definitely helps. Especially right on social media, we are bombarded by a lot of messages, and we get information really instantly. Our brains were not made for that, right? It's great that we can get TikToks that are 10 seconds long, but I know my attention span has gone down since TikTok took off here, right? So ensuring that we take that time off, reading a book and doing other things, and just setting it aside, putting your phone on mute if you can. Setting boundaries is another way, and learning how to say no, right? So this is both personal and professional. I know it's really hard. I'm not saying that it's not, but learning how to set our boundaries or recognizing what our limits are too definitely does help, and that goes into taking care of ourselves. And I put here asking and accepting for help and support. We oftentimes acknowledge that in others, right? Let me know what I can do for you, how I can help you. And sometimes, as I know, some of our not social workers, right, try to solve the problem solvers in their groups. We try to solve things for others, but it's also okay to get that help from others and that support when you're not feeling well or when you need just help and you're struggling. Research has also shown that gratitude and reflection, right? So thinking about, two or three things that went well during the day, and sometimes that's the if the weather was sunny, that's a great thing. A lot of times we live in, especially now that the sun's setting earlier, or the weather's kind of yucky, right? It's okay to, even if that's our gratitude for the day or reflecting how things went, right? Or what you can do to improve the next day. And then taking time to yourself, right? I can't emphasize this enough, right? Ensuring that you are taking your pay time off and your sick time, right? It is sick for a reason, or for some of you, you may get them all at once at the beginning of the year, or if you're accruing it, right? There's a reason why you're working, and that's part of your benefits. That's part of how you're getting paid, right? So if you add up or kind of calculate how much you're getting paid per day or per hour, and think about it that way, right? You're actually losing money if you're not taking your PTO, if it doesn't roll over, and even if it does, right? It's made to make sure that you are taking it. I've definitely taken, an extended weekend here and there where I just do nothing at home, right? Just because we take PTO, it doesn't mean that we're going on a vacation or something like that. And then when is it time to seek help, right? So when these strategies are just not helping, period, right? Sometimes they're not helping at different types in life, but if you're trying all of them and it's just not helping, that's a sign for needing help. When you're having difficulty sleeping, changes in appetite or unplanned weight changes, right? Things that you start noticing in your body. So difficulty getting out of bed because of your mood, difficulty concentrating more than the usual, loss of interest, inability to complete usual tasks and activities, right? This doesn't mean that your usual laziness or your mood, right? But just it's been a thing for days and even weeks. And then signs of distress, right? When you know that you're always kind of on high alert. And then the next slide, it kind of breaks it up a little bit better in terms of um, behavior changes, physical symptoms, like I said, aches and pains, or a lack of interest in not engaging in usual activities, right? Or even thoughts, right, to the extreme again, thoughts of death and suicide. So discussing these more usual or thinking about those things more usual. And then substance use, right? It's definitely okay to enjoy, a drink here and there, but if you start using alcohol or other substances more than usual, that's definitely a sign that there's something going on. So if you get to that point, right, Sada is going to talk about how to find that cultural relevant help.
Thank you, Gustavo. So again, it's very important for us to look at this through a cultural lens. And I use relevant or appropriate instead of competency because I think we can't 100% ever achieve competency. Even myself and Gustavo, although we both identify as Latinos, we're both very different and come from different backgrounds and experiences. So it's very difficult to say that we can achieve full competency. So I want you all to think about that as you are looking for additional support. And if it's in the form of a therapist, what will that look like? So I have some advice when it comes to searching for a therapist that is culturally relevant, responsive, or appropriate. So here are some things that you want to consider. So therapy nowadays, thankfully, we've expanded in types of settings, in what can be discussed, in the way that we can do therapy, which to me is for the better. A lot of this came out of the pandemic and introducing more of a world of telehealth, which can be very beneficial for some folks if that's what you're interested in. So here are some questions or some tips that I want you all to look at before you do your research and start looking into a therapist that could be the right fit for you. So first question is, do you prefer a virtual or an in-person setting? This can be 100% personal, and one way is not the best way. It's whatever works for you. The second one is, do you feel more comfortable with a therapist of a certain gender? And that is 100% okay and normal as well. What other expertise or what are the specific expertise that you are looking for when it comes to a therapist? So we can all be therapists if we're licensed clinicians, but a lot of us have particular specialties and expertise that you might be looking into, depending on what it is that fits your needs, right? You want to look for a therapist that's going to cater to your needs that at the end of the day. And the other most important thing that I think is important that we talk about is that you do not have to stay with a therapist if you are not aligned with them or if you don't feel connected to them. I use the analogy, I'm a big Disney fan. I don't know if anyone else is a Disney fan out there, but I use the analogy of the prince with Cinderella's shoe, finding the right fit, right? Trying to find Cinderella. So that to me is like finding the right therapist. Sometimes you got to go around with the shoe until you find the right fit, and it might not be the first or the second, but that doesn't mean that you have to necessarily settle if you don't feel aligned or connected to that person. You should still be able to find the one that fits your needs and that's going to make that connection with you. So please know that you don't have to stay if you don't feel aligned or you don't feel that connection. These are just some things that you want to think about before you start doing your research, because this can ultimately be able to help you narrow down that search. And here are some questions, right? So when you get connected to a therapist and you're at the point where you're having your first session, or maybe you're doing a consultation, here are some questions that you want to ask or that you want to think about that could be really important for you. So the first one that I've included is asking them, because it's okay to interview your therapist. I don't know if you were ever given that permission, but as a therapist, I'm telling you that it's okay to do it. So the first one is, ask them, what is your experience working with a client that has a similar identity as me? Second question, what particular training or education do you have on cultural responsiveness? So cultural competency or responsiveness is a huge part of our program or our education as therapists, but there's also a lot of additional continuing education that a therapist can do. And then the last one is, what do you know regarding the mental health stigma and stereotypes that are seen in my culture? So ultimately what this does is allows you to get the sense that your therapist understands you and can be empathetic, right? Where we can't say that we 100% are able to understand your situation, but knowing about your culture can give you a different advantage, right? If your therapist is culturally responsive. So these are the top 3 questions amongst many others that you can ask once you get connected to a therapist. And then we're going to share some other resources at the end, but specifically when it comes to finding a therapist, especially if you are looking for a Latina or a Latinx therapist, these are some amazing resources. If you guys want to take a picture or a screenshot, if you're on your phone, there's a lot of directories that are out there. Therapy for Latinx and Latinx therapy, which are two different resources. I believe they also have Instagram pages. They have their websites. We can share, I can probably put it closer to the end, some of the links so that you guys have access to it. But these are great databases and directories where you can go and search for a Latina or Latinx therapist. The Latinx Practice Collective is another directory that will be launching early next year. That will also be helpful. Psychology Today is actually a pretty cool tool because you can filter out the expertise, right? Any specific certifications that a therapist might have, if they're bilingual. You can filter out a lot of different things. If it's virtual, how far away they are from you. So that can give you a better sense of narrowing down your search. Or you can simply, if you do have, if you are connected to insurance, you can call your insurance company directly and ask them to find a therapist that is in network that's taking new clients, and then give them your preference or all your preferences. If they have to be close by, virtual, if it's a specific gender, whatever it is, and they should be able to help you to narrow down your search. So these are some awesome directories and resources that you guys can get connected to. And hopefully at the end, as we get into more resources, I can put some of the links in the chats for you guys so that you have it directly. And then I think there's 20 of us. What do you guys think about breakout sessions, or are we good to go for the breakout rooms? How does that sound, Michelle?
Yeah, we've got about 20 people in here, and we did have some people post whether they are a student or a professional. What we have set up for you all is to choose, you can self-select which breakout room that you want to go into. There's going to be one led by Sarah and one led by Gustavo, just a chance for some smaller discussions. These will not be recorded. If for some reason Zoom lies and it does record, we will edit those out before we share those. So know that those conversations will be private. And so I'm going to open that up and let you all self-select which room. Now, Sarah, correct me if I'm wrong, you're doing the professional room.
Yes.
And Gustavo is going to do the student room, correct?
Yes.
Okay, well, I'm going to open the rooms so you all.
And in mental health, the Jet Foundation and Mental Health America has several different resources on there. The Trevor Project is specifically for the LGBTQ and queer community, right? There's a National Suicide Prevention Lifeline. So if you're ever in distress, or someone else is, or you need help, or you just want to talk to someone, you can dial 988. There's also, you can text really anything but home to 741-741, and someone will talk to you or text you. So there's a great resource, right? You don't have to be in suicidal ideation or in crisis mode. You can, if you need to talk to someone, someone will. There's veteran-specific resources. If you're experiencing a disaster, right? I know I'm from Houston again, so I deal with a lot of hurricanes at times. So you can always talk to someone if you're experiencing a disaster and you're experiencing distress because of it. And I put some other things here like SAMHSA, the Administration for Mental Health, and the CDC, right? It's important that we get our resources or information from reputable sources, right? So ensuring that. And then locally, you can always dial 211 and they'll connect you to resources around you, right? So if you're looking for therapists or local nonprofits, you can dial 211 and they'll connect you. Usually it's run through United Way or through your city or township. In the next one, you'll see here some of those resources I talked about. So Mental Health America has what they call a mental health test, or take a mental health screener. So if you want to see kind of like getting your blood pressure checked, if that's a good way to put it. But just because you get your blood pressure checked doesn't mean that you're going to know, like if you do it yourself with your, machine from the pharmacy, it doesn't mean that you're diagnosing yourself with high blood pressure, right? So that's exactly what this mental health screener is. It's not, diagnosing you with everything, but it will suggest, where you're at, taking the temperature. Like I mentioned, the JED Foundation here has a mental health resource center and the Trevor Project. A lot of these will have like information also in blog post form, so it's a very easy to digest information, right? You're not reading white papers or anything, difficult to understand, but there are statistics and other things here that you can take advantage of. So I know that was, a lot of information. We're really just skimming the surface around how to find culturally relevant care and resources. But here's our emails, right? Mine is molinargustavo@gmail.com, and then Sara's is sara@thefirstgenmadrina.com. So feel free to reach out if you do have more questions. I'll stay, or I can stick around for a little bit more if y'all have other questions or comments. But thanks again for joining us this evening.
Thank you both to our speakers, Gustavo and Sarah. We're so appreciative of your time, and thank you so much for everyone who logged in to participate tonight. I think it shows how important this topic is, and I certainly want to say thank you to our Honeywell partners who sponsored this event and our first event. I'll be sure to send you the recording from the first event that we did. And information about our upcoming events as well. This is not the end of the conversation. We still have more to go. So we have more events planned to talk about this. But I do want to thank you all for coming. Thank you to our speakers, and thank you so much to Honeywell.
Thank you, guys.